Good morning, everyone. Welcome. My name is Sandra Bleckman, and I am the Director of the Health Services Strategy and Workforce Partnerships, together with my Program Manager, Stephanie Samuel, and on behalf of Catherine Stargell, our Senior Director of Workforce Strategy, and our President, Dr. Erin Fickner, I'd like to welcome you to our May edition of the Health Services Sector Collaborative Meeting. We are also in partnership on this journey and initiative with New Jersey Business Industry Association. So I'd like to just thank NJBIA for their constant support. They've been an integral part of this initiative. So today, as every month, we have a theme. Our theme is dual enrollment. So I'm just going to give you a little snapshot on today's agenda. It's a wonderful agenda. I'm so excited to have our presenters here. The first portion of the program will be about the importance of dual enrollment and best practices. And we have our expert speaker, Davis Jenkins, from the Community College Research Center at Columbia University. We then will move on to our Pathways to Career Opportunities segment that we host each month. And this month, we'll be featuring a partnership between the Somerset County Health Sciences Academy and Raritan Valley Community College. And then to finish up the program, we'll have student spotlights. And this is a really special part that I'm so excited for. We actually have a current student who's enrolled in the program that we'll be highlighting, as well as a student who graduated last year. But the exciting part is their siblings. So I can't wait to hear from them as well. So today, to start, before we get started, I would just like to remind you, every month we ask that you do a survey. If you can scan the QR code, we'll also send a link. Your feedback is super important to us. It helps shape and mold the next meetings, think of topics, things of the nature. So it's super important, and we really would appreciate your responses to the survey. And then just to spread the word, if you could use our hashtag NJ Pathways, if you are sharing on any of your social media outlets, we'd love for you to tag us and also use the hashtag NJ Pathways. So thank you so much for that. And we're about to go to our next portion, which is Davis Jenkins, who I'm so happy to have with us here today. Davis actually spoke at our collaborative meeting 2 weeks ago, and I was so excited to know that he was going to speak at our meeting as well after hearing the fabulous information that he gave us. Davis Jenkins is a senior research scholar at the Community College Research Center and research professor in education and social policy analysis at Columbia University's Teachers College. He works with colleges, schools, community groups, and employers in communities and states across the country to find ways to improve educational and employment outcomes for students from groups that have been poorly served by the U.S. educational system. For the past 6 years, Jenkins has led research involving over 100 colleges nationally on the implementation of pathways reforms and their effects on student outcomes and college performance. His recent publications include From Guided Pathways to Cross-Sector Pathways Partnerships and the Dual Enrollment Playbook, a guide to equitable acceleration for students. Jenkins earned a PhD in public policy analysis from Carnegie Mellon University and a bachelor's in religion from Princeton University. We are so pleased to have you back with us, Davis, and I'm going to let you take it away. So.
Thanks, Sandra. It's great to be with you, Jersey folks. I love Jersey. I wish I were there.
We wish you were here with us too.
What exit? I just want to give a big picture. I've been in this career pathways business a long time. Since the late 80s, early 90s, I helped develop this idea of stack credentials. Seemed like a good idea. It turns out not many students stack credentials, but so we've seen a lot. We've seen a lot of successes, but what we've lacked really is scale. And there are all kinds of transformations happening, obviously, in our society generally, with industry and healthcare, et cetera, but higher ed especially, and to some extent K-12 is really facing the kinds of competitive environment that healthcare and other industries have faced for a long time. So there's a real opportunity to rethink what we have now, which in Jersey and elsewhere, it's not just Jersey, really is an education system that diverts students and sorts them based on race and class using bogus uh, assessments of students' abilities and potentials, to really thinking about this as you in healthcare employers think about your industry and your suppliers as a supply chain, and for individuals as a pathway that families and school board members and students can see the pathway through college, through through high school and post-secondary, and into well-paying jobs where ideally you get a job that pays a decent wage to start, and your employer, not the taxpayer, will pay for your training, your further education at the bachelor's and beyond. The other bottom line thing is the increasing importance, is this has been increasingly true in healthcare for a long time, of degrees, of at least an applied associate, like an ADN, but increasingly bachelor's and graduate degrees, but not just any old degrees, degrees with skills and experience. So I mentioned the sorting system. I mean, basically we have a system that starts very early to sort students by race and class. It does this using what I would call Sputnik era mathematics, standardized tests on abstract mathematics that no one, as far as I know, in the healthcare uses. It's very based on abstract manipulation of algebra and calculus, which, I'm a quantitative researcher. We use applied algebra. We don't use calculus because computers do all that stuff. And certainly in healthcare with measurement and estimation and statistics and other things, students don't even get a sense of what this is all about. They just think they're stupid at it, which is not good. The sorting happens within sectors, start within levels of education, but it really happens in between. And increasingly, as we know, we're seeing this really, which was exacerbated by COVID, the real barrier between secondary and post-secondary. And again, remember, well, in healthcare, you need degrees plus skills and experience to get a good job and advance in high school. You can't just have solid post-secondary vocational training or secondary vocational training, which is a great start. So dual enrollment, which is offering students college courses in high school, is emerged as an opportunity to really rethink this high school to college transition at scale. I'm interested in scale because my career, I put together helped to put together and fund and do research on smaller boutique programs, and obviously it has to happen locally, but doing this at scale. So there are a number of models. One is early college high school, and a version of that is P-Tech. These are high school programs that are designed in a more coherent way. In the best cases, like P-Techs, they have an industry or an academic area focus like STEM or manufacturing or healthcare. But they offer college credit for students. There's extremely strong experimental evidence. In other words, randomly assigned. You guys in healthcare will know what that means. This isn't just a correlational study of, dark chocolate makes you thinner and sexier. I guess if that was true, I'd be a supermodel. But these are randomly assigned, and they show strong benefits, especially for low-income students, first-generation students, students of color, students who've been poorly served by our education, in increasing the rate at which they go to college direct or post-secondary education directly, perform in college, and get college credentials, community college or other credentials. They're very powerful. And I'm all for them. The issue is they're very small scale. I did some searching around. I'm sure there are more, but at least according to the P-Tech folks, there are 4 P-Techs in Jersey, and they're probably early college high schools, but it's not as developed in Jersey. The second is dual and concurrent enrollment, where students take college courses sponsored by a community college or university, either in the high school, taught by high school credentialed faculty, or on the college campus. We have found evidence, moderately strong evidence using quasi-experimental evidence research, that these are effective again in not only helping students, motivating them to go to college, but get college credentials. So potentially powerful. They're very large scale, as I'll mention in a minute, although not as much in Jersey, but still 14,000 students I was able to see in Jersey dual enrollment. The problem is that they've often been done as random acts. Just take a course. and they've been focused on gen ed, not on programmatic, like taking the kind of science that you would need to get into clinical areas of healthcare, or the kinds of the high school courses and college courses you need for non-clinical jobs. And generally they've been taken advantage of, like AP, by families and students and families who are already going to go to college, and therefore sort of programs of privilege. The next area is often not considered dual enrollment, but I think we need to think of it more in that this is high school CTE. This is career focused. It's very large scale, 77K. These were just my rough estimates, looking around the website. They're career focused, which is good. They serve a diverse group of students. The problem is traditionally, and by and large, and there are many exceptions, and I know you're going to hear exceptions from Somerset and Raritan Valley. There are exceptions, but generally they've had poor articulation with post-secondary career technical education. And like I said, anymore, you need degrees plus skills and experience. So these students are getting skills, they're in an industry. That doesn't mean they're going to stay in that industry, but it's motivating. So these are the models, and generally what we want to try to do is take these larger models, the dual and concurrent enrollment and the high school CTE, and transform them so that they're more coherent, like education, early college, high schools, and P-TECHs. So dual enrollment has grown nationally in community colleges, especially. About 70% of it's in community colleges. You see this varies greatly by state. The percentage of community college students are dual enrollment. Look at Iowa, where I was just 2 days ago, 37% of their community college students. In Jersey, it's much lower, it's 6%, but it's still, like I said, fairly substantial. And when you look at Jersey and the rest of the country, these are the growth in community college enrollment by type of student. Before COVID, even in Jersey, you'll see the only growth, which was the blue, is in this 17 and younger, which is the dual enrollment students. One reason it's not as big in Jersey, 85% of school districts nationally, and probably in Jersey, offer dual enrollment. And you can see the Jersey map is lighter. This is the dual enrollment. The percentage of high school students in districts who participate in dual enrollment is lighter in Jersey than in like Texas or in the middle of the country. Is that Jersey is very advanced placement focused, AP. I could go in the difference between AP and dual enrollment, but let me just say there is no, the only evidence that AP supports college going is in studies that where the student takes at least, or takes the test, the AP test, and gets at least a 3. What AP lacks, I'm not knocking AP, but what it lacks is an industry focus, a motivation, a working with a college instructor, and the potential for advising by college. It's based on this idea of academic standards, not motivation for college and careers, which I'm going to argue is the key thing. So it's inequitable. The folks, Sandra and company, are going to hand this out to you. You can look on this. It's in Jersey and nationally, participation in both dual enrollment and AP are inequitable. Overall, about 10% of Jersey students participate in dual enrollment, and about half of the Black students in high schools do. And you can look at specific districts. So the idea here is, especially with respect to the dual enrollment course taking and career technical education, sometimes called career academies. And again, you're going to hear some good models of this from Somerset and Raritan Valley. Working with employers, and this is the key, is to backward design these supply chains so that when students are taking high school dual enrollment courses, they're taking courses and they're advised on a pathway that leads to post-secondary education, especially the degree level, whether directly at a bachelor's or the applied associate, and a job with a living wage in healthcare in Jersey or the given sector. Students are advised by the college on a programmatic basis. And there is an effort to really engage students, especially the men. Why aren't there more male nurses? I mean, I know there's there's lots of cultural issues, but, and not just in healthcare, but the men and boys are just, we're in trouble. They're not going to post-secondary education, as you know. And again, the reason is, I think, this lack of motivation, this more academic education that is so stressed in high school, because it leads to the more high remuneration paths, the traditional college degree path is not motivating for them. And then reaching out to communities that have been neglected. We've done research across the country on dual enrollment. I remember being in West Palm Beach, talking to parents at a community group there in an African-American community. In Florida, dual enrollment is a really good deal. I mean, if you get an associate degree in dual enrollment, you get a free ride at University of Florida. The state colleges, which are the community colleges, will offer, if you get 30 credits, they'll offer you the rest of the associate degree for free. It's the biggest free college program in Florida, and those that are, again, industry based and have an industry tracker, even more powerful, we know from the research. But these families are saying, no one told my kids or me about this. And they were very skeptical, actually, that it was free, because they just used to not being well served. So we got to reach out to these communities and tap into the motivation. So here's my main advice from many years in this field. Work with the employers. Got to work. You got to work with the employers to backward map through college, through post-secondary education at different levels, and down into the high schools, the educational paths. And let's start to eliminate these barriers, these arbitrary barriers of math, standardized math and tests. High school grades are very good predictors. They're not predicting because of college success and, frankly, career success. They're not predicting your ability in algebra or even how smart you are or whatever, which is absurd. They're testing, did you show up? Can you multitask? Can you deal with this rule-based system? Can you deal with some crappy teachers and some great teachers? Can you do stuff like we have to do every day at work? That's what they test. That's the key to success. And develop these roadmaps to debt-free degrees in high opportunity careers in healthcare in Jersey. Giving students and parents isn't enough. We have to motivate students through opportunities for networking, exposure, experience. This is what students from low-income communities lack. And again, we focus too much on academic readiness and not enough on, I want to work in health informatics. And I know I got to take statistics, but, I'm motivated, and I'm going to go to the college and they're going to help me take statistics, and the tutoring center is going to help me. It's a different mindset. We got to motivate students. And one thing I do want to point out is we're not trying to get students in high school to decide on a career. What we want to do is get the students have a network and start to get in a direction. And then once they're in a direction and they have a plan, who knows where they'll lead? I mean, healthcare employs every occupation under the sun, everything, clinical, non-clinical, manufacturing, everything is in healthcare. What matters is to get students motivated, connected, and a plan, and have confidence as learners. So the last thing I'll say is that this really requires changing mindsets. We have to get beyond the boutique heroic programs. We have to really change mindsets. And if the healthcare in Jersey wants to recruit a diverse and talented workforce from Jersey, that's going to serve a very high-tech industry that requires huge amounts of customer service, et cetera. One of the most important, if not the most important industry for Jersey, we got to really work with our educational systems to basically build this talent supply chain and focus on educating. College isn't expensive if you can get like an applied associate, get a job in a hospital, they will pay for your technical training from vendors. They'll pay for your bachelor's degree. They'll pay for your graduate degree, and or you'll be making enough to support yourself as you pursue your education. We got to get beyond this, I would call it prep school approach to sorting, which is very big in the minds of middle-class people in families and low-income families in Jersey. We have to change the mindset and show students that and families there is a debt-free path to college degrees and careers in healthcare in Jersey. There's lots of examples from across the country, but I think you guys have the opportunity here to really make this happen on a large scale. And anything I or my colleagues from CCRC can do, you let us know. Here endeth my sermon.
Thank you so much, Davis. What you said really resonated with me, and that last slide with the tips was so important, right? There's so many critical pieces of advice there for us. And through the collaboratives and the centers of workforce investment, we're really focusing on exactly what you said. So I feel like we're heading in the right direction.
You are
working with industry, talking to the employers, really giving students not just here's a one-dimensional map, this is what you can do, right? And the big piece is the equity piece, right? Making it equitable for all. I know when I first learned about dual enrollment, I thought, why didn't I know about this when I was in high school? And everybody should know about this, right? Why doesn't the whole world? I wanted to put up a billboard, right, about it and just share it. We do have a few questions for you. So if you have a moment to stay with us, I'd love to.
Just give me the easy ones, because
yes, only easy ones. Well, I'll try.
Although
there's a lot of questions, so I don't know if we're going to be able to get to all of them, but I want everyone to know that we will be sending Davis's PowerPoint presentation for everyone. So the first one is, what are the barriers to making dual enrollment more equity minded? It seems that many of these programs are, as you say, programs of privilege. Most seem to apply an AP approach to which students can take dual enrollment courses. And
that's fine. But what college-going families and students are doing, they're jacking up their college resumes to get in selective institutions and able to take, so they don't have to take the 101 courses. They can take the more advanced courses when they get to college, and that's fine. I'm not knocking it. But what we're talking about here is working with industries to create this. The biggest barriers are, number one, the stupid use of placement tests. During the pandemic, a number of states, Florida, that have big dual enrollment, Florida, Texas, Ohio, waived the placement test because kids couldn't take the stupid placement tests, which are like a watered down version of the SAT. The Education College Board makes this AccuPlacer, which I call the InAccuPlacer. Any event. And so students, they just relied on high school grades. And guess what? I just saw data from Florida that many more African-American males, low-income students of color, low-income white students were taking dual enrollment in Florida during the pandemic because they didn't have to, actually, Florida they paid College Board to make this PERT, test, which is like the InAccuPlacer, I call it the impertinent. But guess what? And then how are they doing? They're doing as well as the other students. So we got to get rid of these arbitrary tests. Absolutely focus on high school grades, encourage students to take challenging courses. They should, but the high school, the test your race and socioeconomic status. And last I checked, that can't be changed. Student can be motivated. Look, Davis, you could go to Raritan Valley on this healthcare pathway and look at the industry is just screaming for these jobs, and you're interested in business. Okay, there are also non-clinical jobs in business, or IT. Hospitals are screaming for IT people who have some. So you can show your family, here's this debt-free thing. The second thing is we got to reach out to underserved communities because we're just turning away talent. And I'm talking about going to churches, get some grandmothers, some like church lady grandmas educated on this, community organizations, obviously local chambers. This has to happen even in Jersey on a regional level. You guys are doing the overall thing. So really selling this, but selling the maps. I'm telling you, selling the maps and how it's debt-free and how it leads to a job, very compelling for parents, students, school board members who are still in this SAT, AP mindset, which isn't serving the students well, especially low-income students, and it's a barrier to talent for industry. Sorry.
Thank you. And we can tell that, you're very passionate about this, but you've been doing this work for so long. And you really have a handle on what's been happening and how it's been progressing. And really, we're so focused on making sure that all of our pathways are equitable and that everyone knows about them. And we've been involving in our ecosystem community-based organizations, because that's how we get into the community, right? We are the community colleges. We represent our communities.
Right. But the thing that's going to sell this is the industry involvement. I mean, if they just see a map that leads to college, they're going to be suspicious. But if the maps can be sanctioned by your employer associations, by your local hospitals, by your local, that's compelling. And again, showing we focus on the cost of attendance. No, what is the cost of getting this degree that is going to get me a good job in healthcare in Jersey? We can do that much more effectively to students. And yes, reach out to communities who aren't often going to hear this.
Absolutely. One question is, what is the source of your data on the number of dual enrollment students by state? We're asking for your secrets.
Yeah, okay. It's a proxy. We use the IPED's fall enrollment data, which is the federal fall enrollment data. It's not that good. And then looked at students under 18. It's a proxy. It's not perfect, but actually it turns out we do work in many states and have detailed, not Jersey, but detailed state data, and in CUNY, and it maps pretty well. It's not exact. It's just sort of relative.
Great. We are running low on time.
But, and I'm going to ask that other tool, the map tool, actually was based on a high school survey done by the feds. It's a census, and that data is also somewhat problematic because dual enrollment wasn't well defined, but that is data from high schools. Those maps and the equity gaps are based on data from high schools.
Great. One last question. How can we scale up dual enrollment in New Jersey?
I think this is the way. You've got to show families and students the path. And what we've seen elsewhere is once this gets part of the in the community, and parents and families and community groups and local chambers, and people start to get this. We have these pathways in Jersey. Why would you go get a traditional degree or not go to college? I really think it's a mindset change. This is a social change, and community colleges, as you know, we love you guys, but you got to do it because your enrollments are down, and we got to rethink not just community colleges, higher ed generally.
Across the board.
The 4 years, some of them are rocking it, but fortunately for you, they're slow. And so the community colleges, as always, and we're seeing this across the country in Jersey, really making the big changes without the money you need. But the key is the connection with employers on one hand, and the strong connections, which you're going to hear about now from Somerset and Raritan, with the schools and in schools where there isn't cooperation, for whatever reason. You want to reach out to the families and the parents and show them the maps to high wage, good jobs in healthcare in Jersey. And, people have, as you know, very limited understanding of the kind of employment that healthcare provides, but, it's every occupation.
As you said, every occupation. We actually have one of our centers focused on healthcare tech and admin, administration. So it's amazing to see.
Hospitals are
I'm learning a lot as
people.
well.
Yeah, I know.
So,
see if you
well, thank you.
Yeah.
Thank you so much for joining us today. I know there are other questions we didn't get to in the chat. So if you have time, David's like scroll through. If you want to answer via the chat, that would be great. Thank you again for this wonderful presentation.
Anything we can do, let me know.
Absolutely. We'll be calling on you again for sure. Thank you. And so now onto our second portion of the program, our pathways to career opportunities. And this is always a great time to highlight those promising partnerships and really let everyone know what's been happening throughout our community colleges and our county vocational technical schools. So today I'm pleased to have Teresa Morelli and Katisha Gloucester. Teresa began her career as an English teacher in New Brunswick High School and at Somerset County Vocational and Technical High School. She currently supervises English and Spanish departments, the Media Center, and the Academy for Health and Medical Sciences. Teresa has been with the Academy since it began in 2006, which when I heard it started in 2006, and this was the first I'm hearing of it, I said, shame on me. And credits the strong partnership with RVCC for the program success. And really, we're going to talk about it a little bit more today, but partnerships are really how we move forward, right? Creating these partnerships. And we also have with us Katisha. Katisha is the program manager of the high school outreach and academics at Raritan Valley Community College. Katisha Gloucester began her career in higher education as an admissions counselor more than 12 years ago and joined RVCC in 2018. She previously worked in the role of testing center coordinator prior to becoming the program manager and is passionate about supporting students throughout their higher education journey. So I'm going to turn it over to you. Thank you so much for joining us. And if you do have questions, please place them in the chat. Thank you.
All right, hi everyone. Again, my name is Katisha Gloucester. I'm the program manager of high school outreach and academics at Raritan Valley Community College. And my co-presenter today is Teresa Morelli.
Hello.
So we definitely want to take some time to give you guys an overview of the Academy for Health and Medical Sciences. So the Academy for Health and Medical Sciences is a rigorous 4-year honors program for highly focused college-bound students. The program is a partnership between Somerset County Vocational and Technical High School and Raritan Valley Community College. Successful students will graduate with both a high school diploma and an associate degree in general science. Now, I just want to go over a few of the benefits of this program. It's a small learning environment and cohort of students. Cohorts average about 20 to 25 students per year. We had 25 students who graduated in May of 2022. And we currently have 21 freshmen. It also allows these students to develop a really supportive rapport amongst themselves, right? They have scheduled classes every semester, and they take those classes together. So they move at the same pace at the same time. So they are able to socialize and connect and support each other as well. The Academy staff collaborate to ensure student progress. There is a steering committee that is in place that works together to plan for the future, as well as addressing arising issues. And this is a really strong point for us. In order to make this Academy work, it is important that our partnership is very strong and that there are clear communication, that we are constantly updated on each end of what is happening, since classes take place at the high school campus and also at the RVCC campus. The Academy also prepares students for a 4-year college upon graduation. I want to add here that students often report back about how their Academy journey helped them with their social growth and accountability when they start attending 4-year colleges and universities. And that's important feedback for us to know, because we need to know if this program is effective. And if the students aren't telling us that, if the students aren't giving us that feedback, if that's not what we're hearing, then obviously we would have needed to reevaluate what we were doing, but it's been really helpful and supportive for us to hear feedback from students when they move on to other institutions. And the partnership with RVCC is for dual academic credit. So students are able to complete college level courses while at their high school, which allows them to save time and gives them the opportunity to explore career paths in health and medical sciences.
Okay. Next slide, please. Hello, everyone. I'm Teresa Morelli, supervisor of the Academy at the high school, and I'll give you a brief overview of the four-year course of study. We have it broken down so that it's a little easier to manage, at least I hope so. There are a number of courses which function for dual credit, the English, the Chem 1 and the Pre-Calc 1. They function as both high school and college credits, and they help fulfill the requirements for both degrees. And you can see there is a larger number of courses that the students take, which are for RVCC credit only. Now, it continues to be a daunting effort to make sure that we align everything that the students need in order to maintain, in order to graduate with both degrees. Students frequently ask us, well, can I take this instead of this? I said, well, there really is no wiggle room, and I quote, because we're jam-packed to make sure that both curricula are shown in every year. Now, it used to be that the students in ninth grade started with one college course, but because of the state of New Jersey has changed the course load for the associate's degree, and they've capped it at 60. Our students had been earning 63, 64 credits. Now, as you can see in the right-hand side, our students earn a number of credits every year, and they go a little bit above the 60 credits and it refers to the senior year. The path that the college has set up for their program is in senior year that they would take Calc 1 and Stats 1 during the year. Most of our students take both semesters of calculus, and that makes up the extra credit, the credit for that year. But they graduate with 61 or 62 college credits from RVCC. And as Katisha just mentioned, we just graduated 25 students. And I must add that we're very, very proud of them. Now, one other thing, in the past couple of years, this program has been designated a bona fide CTE program by the state of New Jersey. And as such, we have had to make some amendments to some of the courses and add some. For example, if you take a look at the 10th grade, we have added medical math and medical terminology. It's one semester each for the students, and that's a more hands-on, nuts and bolts, basic introduction to the medical field. And yet, I say basic, but it still adds to what the students need as they continue in A&P, bio, and chem on the college level. We also have workplace experience, which we have put in 11th grade. That is, we really were stymied because of COVID in the last couple of years. It goes without saying. In this program, students receive preparation about workplace readiness, anything from filling out an interview form and to being in an interview, to learning about workplace politics and all of those other things that we as adults have to deal with. But we try to show the students that when they leave the academy and go on to their 4 year, most of them go on to 4 years, that really there's an opening for the sky's the limit. I like to say it that way. And many of them do not continue in medicine, for example. We have a number of students who've gone into the humanities. We've had psychiatrists, we've had forensic people, we've had business people. A number of students have gone into business. But this program has opened up their um, their opportunities, if you will. Now, the previous speaker, Mr. Jenkins, really hit on a lot of the, let's say, I won't call them obstacles, but some of the issues that we've been dealing with as we move forward in the program, because we also would like to open the Academy and this wonderful opportunity to a greater group of students. And so I really welcome hearing all of the suggestions and just even very small things that we could try to open it up. I'll state it right here. Two of our, well, one big obstacle is it's money. And I think that hits a lot of us. And it just is sad for me to say that a student may be stymied from going forward in pursuing education because of a money obstacle. So these are some of the basic things that we've been grappling with. And I was speaking with Sandra earlier, and she's smiling now, and it's across the board. It's not just us. And we also try to, again, along with what Mr. Jenkins was talking about, we also try to involve the community with, they're not steering committees, they're groups of people from the industries, some doctors, yes, but also some people who are in different form of the medical field, who would come and work with us and tell us what they need out in the field, so that maybe it could inform some of the following work that we do with our curriculum. So I'm not going to read every bit. You'll see typical high school courses, and you'll see a very large amount of college courses, but it works. The students fulfill the requirements of the New Jersey diploma, and they fulfill the requirements for what RVCC's trustees say is for the associate degree. So let's go on to the next one, please. And these are very fast facts, and I'll make them as fast as I can. The admissions, again, we talked what Mr. Jenkins was talking about. We do base our admissions currently on the GPA, on test scores, and an interview. The interview has turned out to be a very fine way for us to gauge how much the students really want to follow in this program and how much they're truly interested in what we are presenting. And that matters, because you have to like what you're doing, as we know. Transportation, a very basic high school question. This is provided by the sending district, and we give ample information to our families during the summer, and we offer assistance as needed. Extracurricular sports and activities. Again, remember, this is a high school, so we have many of the sports that you would expect, and some we don't. And we try to offer a large amount of activities for the students. One last thing before I'll stop. Up until a few years ago, when the state of New Jersey, no offense to New Jersey, added a few more requirements for the graduation degree, up until a few years back, we allowed one period a day for all the Academy students to have, let's call it rest and relaxation. We called it a clubs and activities period. And that was what we based our model on way at the beginning, because we knew that the kids just needed that. I mean, they're kids. And also they did everything. They played chess, they started clubs, they did knitting and crocheting. And it was a very, very nice way for them to have a respite during the day. But alas, we can't do that anymore, because we have to fill in with a lot of the extra courses from the requirements. Okay, Katisha?
So I'll touch on the last three. So for the teaching staff, it's faculty from both Somerset County High School and RVCC. For freshmen and sophomores, they take their classes at the high school. Juniors and seniors start taking those courses at RVCC campus. And Somerset County high school teachers teach those first 2 years. Those are teachers that have master's degrees in the relative discipline that they are teaching, and they follow the same vetting process as faculty would at RVCC. Now, the articulation agreements, RVCC has articulation agreements with other colleges and universities. A few of those are Berkeley College, Drew University, Rutgers, William Patterson University, and those articulation agreements make it a lot easier for students who graduated with an associate's to then transfer their credits to those colleges and universities. Now, in most cases, credits will transfer to any college in the country once they apply to the attended program of study at that 4-year institution, right? And of course, if the student has a C grade or better in the course. And to touch on challenges, I want to say that this is essentially what Jenkins spoke about with student populations, targeting student populations who have not heard about this program, who are in need of hearing about this, who need this sort of opportunity to start earning credits early in their high school, who have not thought about going to college or university. And those are the student populations that we as the Academy staff need to start working on targeting.
Yes. Yes. Okay. All right.
Thank you so much for your presentation. You know, you actually answered some of the questions as you were going through, but one quick question that I'd like you to answer is, someone posted, how can a community-based organization support you? You know, what can they do? Is there something that you can, you know, share with us now?
Well, one thing I would suggest is to do exactly what we're doing in this program, enlist the aid of the students. I do that with the parent information sessions, and truly, I mean, it's not funny, but the parents wind up asking my student representatives most of the questions, because hearing about the program, obviously, from someone who has finished it or who is currently in it, we get a very real, relevant question and answer session. I think I would definitely start with students.
Well, that you led us right into our next segment, Teresa. So you can lead the meeting now. No, so thank you so much, Katisha and Teresa. It was wonderful to hear about. There are a few other questions in the chat, so if you have some time, if you'd like to answer, that would be terrific. And so, which brings us to our next student spotlight. I actually met Sangeetha at our Scholars Celebration, and as soon as she received her award, I ran up to her and I said, "Can you please speak at our meeting?" I was so impressed, and I am super excited because we have siblings here. Varun finished the program last year. Sangeetha is currently in the program, and I'm going to turn it over to both of you. I know, Sangeetha, you're going to start. Just tell us a little bit about this. You know, how did you hear about it, your experiences? And I know everyone's going to want to hear your plans following graduation. So I'm going to turn it over to you now.
Thank you, Sandra. Hi, everyone. My name is Sangeetha. So I'm a current student at the Academy of Health Medical Sciences. I'm a senior right now. So I entered in 2018, and I'll be graduating this year. This past weekend, I actually graduated from RVCC with my associate's degree. And then in a month or so, I'll be graduating with my high school diploma. So I've really loved the Academy. I'm going to be going next year to Northeastern University for a major in business administration with a concentration in finance. I know a lot of people are surprised when they hear that I'm going to go off and do business after going through the Academy for Health and Medical Sciences, but I've always known I wanted to do business, and I've never regretted going to the Academy just because it's given me so many opportunities and allowed me to take classes that I never would have been able to. I'm still able to transfer 30 credits, which are going to cover my gen eds and eliminate already a year off, which will allow me to do more at Northeastern. I could finish either a year early, or I might just do another co-op or work a little longer. But I really do love the Academy. I always tell people definitely join it. I've been involved in UNICEF Club, the Stock Club. Right now I'm president of the National Honor Society, And I've been involved in Skills USA, which is a club that I know my brother will talk about more. It's a club that we're able to do because we're a vocational school, and our school is very heavily involved in that. So I'll turn it over to my brother Varun, who just graduated last year, to talk about more about himself.
Hi, everyone. My name is Varun Punam. And so I graduated from the Academy of Health and Medical Sciences last year. And now I'm studying microbiology at the University of Pittsburgh. And so with the transfer credit that I earned through this program, I've just come in and finished up my junior year. And so I'll be finishing up this bachelor's degree in just 2 years. Definitely a lot of money saved. And so I'll speak to how those experiences shaped me. Really, one of the things that I wanted to expand upon from Dr. Jenkins' presentation was this idea of comparing AP credit and dual enrollment, which are sometimes treated the same in terms of getting kids through some of the early classes, but really just such different experiences. And so the best way I could put that forward is that in May 2020, as the College Board was trying to deal with how to give tests during COVID, they ended up making the exams these shorter formats in which there was just a couple questions that would be taken online. And they published a ton of YouTube videos about their courses in which they designed the exams. And so they know the specific key points they're going to highlight from a larger course. And so without taking any of these courses, Sangeeta and I would just watch these YouTube catalogs and ended up passing multiple AP exams we had never taken in class, which just really speaks to this idea that AP courses will just be a standard of certain academic skills, but going through a dual enrollment program is just a whole different experience and a very valuable experience in terms of how much you learn to integrate onto a campus, work with certain administrators who will really help you out and go the distance when you're starting to get into tougher and tougher courses in your later years. And so coming on to the University of Pittsburgh, despite me not being there for my freshman and sophomore year, being in a community college environment has helped me to immediately know what to do and how to access certain resources compared to students who are also first-year students who have come from high school and taking some of the same courses as me, but did it through an AP path. They have a lot of a tougher time actually knowing about how to use a tutoring center, how to work with certain academic advisors as opposed to high school guidance counselor. Really, really just valuable experiences. And so in terms of my experiences hearing from Sangeeta going to Northeastern, at a state school, it ends up being that a lot of your credit goes directly towards limiting certain classes. I know that a lot of my peers who are going to private schools end up finding that almost none of their credit gets accepted. But even so, in such cases, the dual enrollment program has a big benefit just because the first time you take it, you're gaining a ton of experience. And as I've already spoken to, it's helpful just to know how to be on that sort of campus environment. And so I'm just thankful to this idea that in order to run a program like this, it just takes so many administrators. I'm really thankful for Ms. Morelli and Ms. Foster working behind the scenes to design this program. I joined with in September 2017, and even within that time, this PowerPoint slide on which courses are in the program has already shifted a ton, just because it's continually changing to fit academic standards. And so I'm super thankful for that we're constantly shifting in order to meet changing standards in order to get 2 degrees.
Thank you so much. And I think that's been a recurring theme in talking to any students that have been through dual enrollment programs is the confidence, right? You have a different confidence than a student who's just an incoming freshman who hasn't been to a community college. It gives you a different set of skills. Actually, one question that has come up a few times in the chat is, how did you both hear about the program? Obviously, Sangeeta, you heard through Varun, but Varun, how did you hear about the program? Was it your parents, first of all, must be super proud of both of you and so excited that you've saved them a tremendous amount of money as well. But how did you first hear about the program?
So I'll speak to this idea that, overall vocational education definitely has a stigma that people need to overcome. Sangeeta and I, in our early home, actually lived right next to Somerset Votech, and so we were always biking in their parking lot, and that's how we actually learned to bike up and down a big hill. And so we didn't really know that high school, like what it offered. For us, was always go to the public school, and luckily we just knew family friends who had gone to the academy in that year. I think that there's this idea that even though Somerset Votech had come to my middle school and spoke on CTE education, it was a little bit unclear to know exactly which programs are offered. And moreover, I think a lot of times students write it off as CTE education is an alternative to going to a four-year school or getting high-paying jobs. And so as someone who ended up going through, as my sister spoke to, Skills USA, which is an organization that really pairs vocational students towards getting opportunities. There's so many things that I could speak to about eliminating that stigma, that the students who do not go to four-year school but went to vocational school achieve high-paying jobs because of their specific experiences.
Right.
Obviously, as I and my sister could speak to, a lot of students, though, go to four-year schools and achieve success. And just in terms of there's a lot of opportunities in going to vocational school because through Skills USA, my sister and I have done all sorts of advising. I actually ended up becoming the state vice president and so of the Skills USA chapter. And so there's a lot of organizations really tailored towards these kinds of high schools and these sorts of experiences that I think are not fully communicated. And just, you know, the public needs to get over this stigma that it's go to the public school, then go to a four-year, then pursue some higher education potentially beyond that. You know, there's a lot of alternative pathways available.
Okay. All right.
Thank you so much.
I'd like to add one thing. Excuse me. Thank you, Varun, for what you said about getting the word out. That's another big reason why we have parent and student information sessions, which we heavily advertise. It's in even local newspapers, our pupil services, when they do go out to the schools, they make sure that the individual programs are explained in detail to the respective counselors. And also, as Varun said, through the other organizations, some scouts, for kids and scouts, for example, that pass the word along. So we're doing as much as we can to, as he says, get the word out, but definitely there is still that idea, oh, Votech, I didn't even think about it. And well,
that's why we're here today, to change
here we
those
are.
thoughts, right? And thank you so much. And thank you both, Sangeeta and Varun, and congratulations on your graduation. I think it's amazing to have an associate's degree for your high school diploma, but we thank you both for taking your time today. There's some comments in the chat congratulating you, and so just take a look at that. And so thank you so much for joining us here today. I'm just blown away by all of the speakers and our students. They were so wonderful, you know, and so as we move forward next month, please give us your feedback. I'm forgetting about feedback here, but please, it's so important that we hear from you to help. You know, we've had some feedback in the chat, but the survey is really important that you give us your feedback. And then in closing, I'd just like you to, if you want to get involved with us and keep receiving invitations, please go to our website, or you can just use another QR code. We're big on QR codes here at the NJ Pathways to get involved, receive updates, invitations, make sure you're on our list for our next meetings. And then just our schedule for the next meetings. Well, stay connected with us. Our hashtags, use our hashtag NJ Pathways, as well as our social media. We hope that you're following us. You can always see any of our presentations on YouTube as well. And next slide, John, here we are, is our next set of upcoming meetings. Next week, we have infrastructure and energy on the 25th. And then starting in June on the 8th, we start a rotation again with manufacturing, supply chain management. The following week is technology and innovation. And then health services again will be on Wednesday, June 22nd. Please mark your calendars. Thank you again for joining us. This has been a wonderful presentation, and a big thank you to all of our speakers again. Thank you so much. Have a great day.